I am excited to share some results from our research recently published in the Journal of the American College of Surgeons. In this retrospective observational study, we aim to understand how multimorbidity impacts long-term outcomes for older emergency general surgery patients. We used Medicare claims data to look at outcomes through 6 months among operative emergency general surgery patients. We classified patients as multimorbid based on the presence of a qualifying comorbidity set, which is one of 75 specific single, double, or triple combinations of comorbidities associated with a greater than twofold risk of in-hospital death after a general surgery operation. So we applied this definition of multimorbidity to the emergency general surgery cohort and analyzed outcomes through 180 days. Of the 174,891 patients we analyzed, 45.5% were found to be multimorbid. Not surprisingly, almost 97% of multimorbid patients had 3 or more comorbidities. But notably, over 60% of the non-multimorbid comparator patients still had 3 or more comorbidities, and almost 80% had 2 or more. Multimorbid patients had 3 times higher odds of mortality during index hospitalization, and this risk differential persisted through 6 months after discharge, with multimorbid patients having over a 17% risk of death within 6 months compared to 3.5% among non-multimorbid patients. Multimorbid patients stayed longer in the hospital. They had a lower likelihood of discharge to home, a higher likelihood of discharge to rehab or SNF. They had greater than 2 times the use of new durable medical equipment like walkers, home oxygen, wheelchairs, bedside commodes, and hospital beds. It cost over $5,000 more to treat a multimorbid patient. And finally, they were more likely to be readmitted to a hospital within 6 months, almost a 40% risk of readmission compared to 21% among non-multimorbid patients. I think it's important to point out that patients care about more than just their risk of death when discussing risks of emergency general surgery. They want to know if they can go home after surgery or if they'll maintain independence, and we hope that our findings will help surgeons to set realistic expectations for older multimorbid emergency general surgery patients. Thanks for your attention. I'd like to acknowledge the invaluable support required for this project.